The information presented in this program is for educational purposes only. It is not intended to diagnose, treat, or cure any condition, illness, or disease. The depiction of successful results from the treatments discussed in this presentation are examples of the possible benefits and do not guarantee results. The decision to start any medical treatment should be made only after discussing all benefits and risks with a healthcare provider.
Welcome to Healthy Dose with Dr. Joe. Are you ready to repair damage to your body? Replace what is depleting to regain your youthful vitality? Regenerate what is now degenerating? Dr. Joseph Gambardella is a doctor of chiropractic medicine and an anti-aging health practitioner diplomat. He was the first doctor in Miami to complete his fellowship training in stem cell therapies. As the owner of Advanced Physical Medicine and Rehab of Miami, he provides patients with the most sophisticated and safest treatments in the market today. Join Dr. Joe for the next half hour and learn about the medical advancements that have helped thousands avoid surgery and pain meds. From stem cells to hormones and everything in between. Get ready to feel empowered. Get ready to regain control and reclaim your life. Now, here's your Healthy Dose with Dr. Joe.
And we're back with another Healthy Dose podcast. I'm Dr. Joe Gambardella with Advanced Physical Medicine and Rehab of Miami. Make sure you follow us at APMR Miami on Instagram and visit our website, 8pmrmiami.com. Today we're going to talk about misconceptions regarding stem cell therapy for treating unhealthy joints. I really want to address this topic today because there are so many choices, there's so much information about stem cells, and there's really no gray area when it comes to stem cells and joints nowadays. There's either people who say it is absolutely incredible, the best thing, you have to get it done, they've done it themselves, or they know someone who has done it very, very successfully, or they say it's bad. There is no gray area. So today we're going to make our way through the weeds. I'm going to tell you about the only two legal compliant ways to utilize any type of stem cell therapy to treat an unhealthy joint. And I'm going to tell you about the 3 secrets to regaining healthy joints and getting the body to heal by itself. So before we start, we have to always state our purpose when we're dealing with patients who are unhealthy, who aren't feeling their best, starting to lose some of their independence. And the number one thing that we talk about in our practice, we talk about in our lectures, and we speak about on the radio and our podcasts, is our purpose is to help the body heal itself without drugs and without surgery. In terms of orthopedic injuries, joint injuries, surgery should always be your last option, not your first. And it's an age-dependent thing. Surgery for older people has its ups and downs. Replacement surgery, as we'll come to discuss later on in the podcast, for younger people is definitely not the primary option or your best option. When people come to see us, they find us through Instagram. Most of the time it's through patients we've treated before. They always have 2 goals, and our goals to help patients are, number 1, get out of pain, help you have less pain. And number 2, it's to improve performance. When you lose independence, when you can't get in and out of your car without pain, you can't exercise the way you want to, you see your body changing overnight. These are things that are you can easily become discouraged with. And rightfully so, because these conditions are oftentimes degenerative and there is no getting better. There's oftentimes things to mask the symptoms, but it's not that symptom management becomes less effective over time. It's just that the problem becomes so much worse that you're unable to treat it. So the first thing that we want to talk about is get the right diagnosis and find out if your condition is degenerative. So there's 2 questions that we have to ask ourselves. Number 1, if you're having pain in your knee, if you're having pain in your lower back, if you're having pain in your shoulder, your hip, your ankle, or your foot, is the joint healthy? And what's a healthy joint? Healthy joints are joints that don't hurt. You could do anything and everything that you want to do, including exercise, including bending down to pick up your kids and grandkids, and including standing and working long hours, sitting at your desk, or whether you have an outside job. You'll have soreness that is associated with tight muscles, but not joint pain. So number 1, if your joint is unhealthy, you are going to have chronic inflammation. And inflammation means you're going to have pain. If you have pain that's been there for more than 3 months, then your condition is considered to be degenerative. And that's the first sign of the unhealthy joint. Question number 2, equally, if not more important, is your degenerative condition affecting the bone or the soft tissue. Let's talk about that. By definition, a joint is made up of two bones and a cushion that separates them. If we're talking about the lower back, it's called your disc. If we're talking about your knee, it's called the meniscus. If we're talking about your shoulder or your hip, it's called the labrum. Same tissue, different name in different parts of the body. When you have a condition that involves degeneration means that the problem will always get worse with time. It never gets better. When degeneration affects the bones grow in size. So a degenerated knee means that the knee is actually expanding over time. The bone is getting bigger. A degenerated lower back means that the bones are growing closer together. When you have a complicating factor, meaning the soft tissue is degenerating, that structure gets smaller in time. It's less able to absorb stress and less able to cushion impact. The worst thing that we're going to see is a condition that involves degenerating bones and soft tissues. So how do you know if you have degeneration? Well, number one, you have to go to an office like ours and get yourself checked. The primary tool that we use is an X-ray and an MRI. X-rays tell us if you have bone degeneration and to some extent soft tissue degeneration like a meniscus or a labrum. And an MRI will give us the definitive diagnosis as to how much that soft tissue has degenerated. So those are the two most important questions that we have to start with. Number one, is your condition chronic? Is the joint unhealthy, meaning you have pain for more than 3 months? If it is, it's time to take action. Number two, is the condition degenerative? If it is degenerative, there are only certain options that you have available to treat. So number one, if your condition is degenerated to a point where you've started to lose mobility and function, first thing that you're going to notice is pain that doesn't go away by itself. Pain that doesn't go away by itself is often first treated by limiting your daily activities. What does that mean? You can't do boot camp anymore. You can't lift weights the way you used to, and you typically take time off and start gaining weight. Most of you who are in this situation know that it's not something that turns around quickly. If and when the pain does go away, as soon as you go back to those activities, the pain comes right back. So that's the first symptom of degeneration. It is considered low risk for surgical intervention. Phase 1s will always turn into a phase 2 degeneration, which means that in addition to pain, you're going to have loss or limited mobility. So you're going to start to see advanced cases of bone growth, tissue damage, and in addition to over-the-counter medications or limiting your activities, you may start to see the use of muscle relaxers and opioids. If that provides any type of symptom relief, you are quickly moving toward phase 3 degeneration, which places you at high risk for intervention. When we talk about intervention in physical medicine, we're talking about arthroscopic type procedures and or total replacement of a joint, a situation where no one wants to find themselves. The purpose of doing this podcast today is to give you enough information to help you make the right decision on how to treat your degenerated joints. So let's talk about treatment options. Number one, which is what a lot of us find ourselves doing initially, is not doing anything. So hoping the pain goes away, taking a little bit of over-the-counter medication, treating the symptom and hoping that the condition gets better by itself. I want to tell you out there that that's the fastest way to get yourself into trouble that's going to require surgery. Why? Because when you wait for something to get better that's degenerative, you have large numbers of healthy cells dying off that are getting replaced by unhealthy cells. When that number goes out of balance, when you have more unhealthy cells than healthy cells, you've lost the battle. You're on a one-way path to surgery, and I could tell you this, in orthopedics, no joint replacement is ever as good as the one that you were born with. So the first takeaway from today's show is do something. In terms of doing nothing, there's also taking medications to mask your symptoms. When we talk about medication, there is no medication that is going to help soft tissue regenerate. There is no medication that's going to stop degeneration. So any medication that you take for an orthopedic joint problem is simply this. It is going to mask the symptom while the problem gets progressively worse over time. That is the next pathway that is going to lead you straight into surgery. And surgery for a replacement is something that is not just age dependent. These, as we'll come to understand later on, there is no replacement that's going to last a lifetime. There is no replacement that is going to get rid of your pain completely. So the best prevention, the best prescription that we can give you is do something before you become a surgical candidate. My background in treating patients with orthopedic type problems, including neck, lower back, shoulders, knees, and hips, is in chiropractic. 21 years ago, I started practice here in Miami, and I helped thousands and thousands of people. What I found is my patient population aged with me is that as conditions became degenerative, chiropractic, physical therapy, massage therapy was less able to help those patients. Because if a condition is degenerative, chiropractic, physical therapy, and even massage therapy will not stop that. So I found myself at a crosshairs about 10 years ago in practice. And I said, there's got to be something better. I was referring patients out to orthopedic colleagues. And what I found is that the patients weren't coming back. They were being put on prescription meds. They were doing joint replacements. And when I did see the patients back, they had the same problem with a replacement joint, and there was nothing else that we could do. So I started getting heavily into research. I started to educate myself about stem cell therapy and became the first doctor in Miami to have a fellowship in stem cell therapy. So what does that mean? It just means that we recognize that stem cells serve a purpose in healing, and there are specific types of stem cells that are most usable in joints like shoulders, knees, hips, lower backs, and even ankles. Some are so effective that they even delay or prevent surgery completely for people that have degeneration. So before we get into that, I do want to take time out and talk about medications. The first medication that people are going to really reach for when they have joint pain is something over the counter, like ibuprofen, Motrin, Aleve. These are called non-steroidal anti-inflammatory drugs. In the world of healing, this particular drug stops symptoms short term, but it also stops your body from healing. It stops all stem cell activity. Listen to what I say again. Anti-inflammatory drugs like Motrin, Aleve, Advil, non-steroidal anti-inflammatory drugs stop stem cell activity. They stop your body from healing. So they give you temporary pain relief, but they stop your body from healing and make the condition significantly worse over time. Muscle relaxers, anti-inflammatory creams, opioids, all of these drugs serve a purpose when they're used short term. I want everyone to go into their medicine cabinet tonight, pick up a bottle of your favorite anti-inflammatory drug and read the back label. And what you're going to find is going to surprise you. And 99% of those bottles say that this prescription, this medication, is not to be used longer than prescribed by your physician. The average time, as stated on the bottle, is no longer than 10 days. How many of you out there are taking Advil, Motrin, Aleve, ibuprofen, non-steroidal anti-inflammatory drugs, and you've been taking them for longer than 10 days? It's a problem. It's not normal to do something like that, and your body knows it. You're putting a tremendous tax on your kidneys. You're putting a tremendous tax on your intestines. There is no drug that you take that does not come with an unwanted side effect. And the side effects of these drugs far outweigh any temporary benefit that you can attain from them. So the second takeaway from the show is that anti-inflammatory medications, muscle relaxers, and opioids to treat pain do nothing to stop degeneration in knees, back, shoulders, and hips. And at best, you're treating a symptom and not the cause. Let me give you an analogy of what this means. If you're driving your car down the road and your check engine light comes on, your check oil light comes on, and you reach underneath the hood or underneath your dashboard and pull a fuse so the light goes out, that's exactly what taking medication for these joint problems does or means. You're stopping a symptom temporarily, but the further you go along in the car or the more you use the joint, the more damage that you're doing. The thing I want all of you to know is that you need to treat your body at least as well as you treat your car. Your car is a vehicle that's going to take you from point A to point B. You may find yourself in your car 1 to 2 hours a day, but you occupy your body 24 hours a day, 7 days a week, 365 days a year. You have to take care of this vehicle as it takes you through life. The care that you put into your body today is what you're going to get out of it when you're 60, 70, 80, 90, and 100. So you have to treat the cause, not just the symptom. In regenerative medicine, we talk about cellular activity in the body that is useful or used in healing. When the body is incapable of healing itself, you've tried medication, the symptoms wear off, they come back, the condition has gotten worse over time, you may find yourself considering surgery. And surgery for lower back involves fusing segments and cutting away the cushion. Fusion for neck and lower back. Surgeries for joints like shoulders, knees, and hips often involve cutting into the body and replacing the entire joint. So this doesn't come without a cost. No insurance, number one, covers these procedures in their entirety. They don't cover time away from work. They don't cover all of the necessary co-payments that you will require when having these procedures. Most insurances cover a portion of the therapy. And they don't cover the side effects, which is time away from work, time away from family, and really the inability to regain the quality and function of your life that you had before you had these injuries. If you have waited too long and it's your only option, you have to go with it. But 90+% of the patients that we see in practice are not candidates for surgery when they come to see us, which is so exciting in terms of doing this podcast and educating people, is because you can still get the body to heal by itself. So let's talk about regenerative cell therapy. What is it? It's a hot topic. What's stem cell therapy? And this is a cellular therapy that has helped thousands of people recover from these specific types of injuries. It's a cell-based, science-based theory, science that involves healing using your body's own stem cells to promote, repair, and restore healthy function to unhealthy parts of the body. When I started off this podcast, I said that stem cell therapy, there's no gray area. You either are a firm believer in it because you've had the procedure done, or you know someone who's had it done, or you say stem cells don't work at all. There's no gray area. I'm here to tell you that there is no gray area. Stem cells work when used correctly. There are specific types of stem cells that are used in healing, and that's the type that we're going to focus on today, and they're called mesenchymal cells. So mesenchymal stem cells are cells that exist in the body in high concentrations when we're younger, lower concentrations as we age. They are called tissue-specific stem cells. In other words, these cells have the ability to do 4 specific things. Number 1, they have the ability to reproduce over and over and over and over again. This is how your body heals completely from injuries. Number 2 is they have the ability to stop inflammation. When your body heals using stem cell therapy, your body reduces inflammation very, very quickly. So you know what that means? That the pain stops. Number 2 is they have the ability to stop abnormally large amounts of cells from dying off before your body can replace them. So what does that mean? It helps your body control and contain arthritis. Very, very important for people who suffer with damaged joints. And number 3 is, depending on where these cells are highly concentrated, they have the ability to allow the body to replace, repair, and restore healthy function to cartilage or cushions that separate the joints. This is how your body heals. And in fact, stem cells are essential for life and essential for healing. The third takeaway that I want you to get from this podcast is that stem cells always work, because you would only exist a day or two without them in your body. That's how important these cells are. They're important for life, and they're important for the life and health of your joints. The more you have, the healthier you'll be. The less you have, the more unhealthy the joint will be. So for people who say stem cells don't work, then how does your body heal? How did your body heal more quickly and more completely when you were younger as compared to when you're 50, 60, 70, and 80? One of the primary reasons is you have fewer stem cells in your body as you age compared to when you were younger. So there's 4 phases of healing involving stem cells. Number 1 is, once you have an injury, inflammation is present. Inflammation involves swelling and it involves pain. This is so important to your recovery because, number 1, when cells are damaged and they give off an inflammatory signal, that signal is what directs your own stem cells to the injured tissue site. So in other words, if you twist your knee playing basketball and it swells up and there's pain, your stem cells are already moving toward that inflamed joint. So the second phase of stem cell healing involves stem cell migration. Massive amounts of cells in your body are moving toward the inflamed tissue inside the knee. The third phase is the most important phase because as long as there is lots of oxygen present, those stem cells are going to integrate with the damaged cells and tissues and release something called growth factors. Those growth factors are what your body utilizes to move into phase 4 of stem cell healing, which is the rejuvenation and regrowing phase. Your body utilizes those growth factors to help regrow damaged tissue. And once that happens, the inflammation, the swelling, and the pain goes away. So if you had an injury and the pain completely went away, you have successfully moved through your own stem cell therapy. If you're out there and you have bad knees or a bad back, you're stuck in a phase of healing. Your healing is incomplete. And as we mentioned earlier, certain drugs called nonsteroidal anti-inflammatories, they completely stop stem cell signaling. So if you take enough of these drugs, your stem cells never even make it to the site of the injury, and that's why you never heal completely and the condition becomes degenerative. So what do you do? When you're sitting out there in your car, you're sitting at home and your knee hurts, your back hurts, your neck hurts. Let me tell you about some of the symptoms that are associated with degenerated joints that have not healed properly. Pain, stiffness, swelling, weakness, clicking, popping, grinding, pain at work, pain with sitting, pain with standing. You can't change positions comfortably. You can't get in and out of your car. You can't sleep throughout the night without waking up with pain, and you're taking medications to limit the symptoms, but they don't work. Those are conditions that need to be evaluated now before you do anything else. 305-598-8788 is how you find us here in our office. Right after the break, we're going to talk about the 3 ways to treat unhealthy joints and get the body to heal by itself. We'll be back right after this.
Repair your body. Replace your key hormone levels. Allow your body to regenerate itself without surgery or meds. When it comes to your health, the best plan is preventative. If you wait for symptoms to show, you could be too late. With over 40 years of combined clinical experience, all under one conveniently located state-of-the-art facility, Dr. Joe is on the leading edge of regenerative and physical medicine. Take control of your health and get a free consultation and evaluation. Visit us at apmrmiami.com or call 305-598-8788. 305-598-8788. 305-598-8788.
And we're back. So if you're driving, you want to keep mental note of this. If you're at home, you want to grab a pencil and paper or type this down on your iPhone or Android phone. When your knee hurts, when your back hurts, when your shoulder hurts, when your leg hurts, 3 ways we can get the body to heal itself. Number 1, improve circulation to the joint. Number 2, add allograft containing stem cells when necessary, when dictated by age and when dictated by condition. And number 3, lose weight. So let's talk about all 3 of these things because they're all equally important. I'm going to grab a model here of a disc in the lower back. And I want to show you and tell you that out of all the human body parts, the part of the body that has the weakest, the most incomplete blood supply with aging is the disc in your neck and in your lower back. What does that mean? When you have a tear to the disc, a bulge, a herniation, or any damage that causes pain to the lower back, it means that the disc itself has been damaged. And because it is the structure in the body that it has the most incomplete and the weakest blood supply with aging, it means that it almost never, ever heals by itself once it's been injured. That's why 80+% of people out there have back pain that doesn't go away by itself. So what's the solution? Let's talk about this for a minute. You go to the gym, you work out, you get what's called the pump. Muscles get full, muscles get tight, and that pump means that an enormous amount of blood has moved into a muscle. And when you are working out, you're actually tearing muscle fibers. But because there's so much blood present within the muscle carrying oxygen, in 3 to 4 days, the muscle is not only healed, but it's bigger and stronger than it was before. Why is that? Because you put stress on the muscle and you added oxygen to help your body heal. When you injure the lower back and you tear the disc, there is no way to get oxygen into this tissue, so it never heals. So the first solution to treating a damaged joint, whether it's the knee, the lower back, or the shoulder, is to get oxygen close to this tissue. And the first thing that we utilize is something called prolozone therapy. And prolozone therapy is combining ozone, which is basically activated oxygen, combined with amino acids, saline, dextrose, and injecting it into the joint or close by the joint. It's essentially replacing the movement of oxygen using blood, using a syringe. So if your body can't push oxygen into the joint, we inject it into the joint. So as soon as your body becomes exposed to large amounts of oxygen where you have a tear in the tissue, you begin stem cell therapy. Because your stem cells can only move where oxygen is present. If there's enough oxygen present, your stem cells are going to release massive amounts of growth factors that your body uses to repair the tissue. So this is why the first secret to regaining a healthy joint is to expose the tissue to large amounts of oxygen. It's very, very, very important. The second thing is we use lasers. Lasers, high-power lasers, cold lasers or low-level laser therapy, even light-emitting diodes, all different ways of exposing the damaged tissue to light therapy. When you have enough power and enough energy moving into the cells and tissues, it allows your blood vessels to expand, get bigger, and become softer. So when more oxygen is moving through those blood vessels closer to the damaged tissue, your body begins to heal by itself. And lastly, we use something called shockwave therapy. Shockwave therapy is a very, very potent, strong sound wave therapy that activates your stem cells by strengthening, expanding, and creating new blood vessel supply to supply tissues that have been damaged with time. So to recap, once a tissue tears, if it's exposed to a large amount of oxygen, it heals completely. That's what bodybuilding and weight training is all about. When you have tissue tears to the meniscus, to the disc, and to the labrum, and no oxygen is present, the body heals incompletely or doesn't heal at all. The first step to correcting that is expose those tissues to large amounts of oxygen. Prolozone, shockwave, and lasers are the ways that we utilize here in the office to do that, to regain the body's ability to heal by itself. The second thing is you need to add more stem cells into the equation if you are over age 35 to 40. Why do we say that? Because the number of stem cells that your body is capable of making significantly decreases as you age. In fact, the older you get, the less stem cells your body is capable of making. And the stem cells that it does make are weaker and weaker and weaker as you age. So the only solution that is compliant with FDA regulations today is using something called allograft containing stem cells that come from umbilical cord tissue. This is basically a Wharton's jelly. And this structure has the highest concentration of tissue stem cells of any human body part. More than body fat, more than bone marrow, more than even stem cells that come from your own blood. So this structure contains 1.4 to 1.6 million live cells per cc. And what does that mean? Well, 25 to 35% of those cells are called mesenchymal cells, the tissue cells that your body uses to repair itself. So on average, you're going to be adding between 400,000 to 600,000 mesenchymal cells into your body as part of this tissue graft, combining with your own stem cells and oxygen therapy to get the body healing by itself. Now, I know a lot of you out there are thinking, well, I want to use stem cells from my own body. Why would I bring in cells from someone else's? And ladies and gentlemen, it's a numbers game. And number two, it's compliance. So one of the biggest misconceptions about stem cell therapy out there today is that you can use any type of stem cell from any part of the body and move it from one part to the other. And that is just absolutely not true. So what was allowable, what was compliant years ago was harvesting stem cells from bone marrow and harvesting stem cells from adipose or body fat. And the FDA came out with a public health service announcement in 2017, and they're very, very clear on this. The only two types of stem cells or stem cell therapy that are approved to treat orthopedic conditions like knees, hips, lower backs come from umbilical cord tissue and bone marrow aspirate concentrate. That is it. Stem cells that come from body fat are not compliant. So if you know people out there that are considering doing a procedure involving body fat, it's just not compliant with what the FDA has put out. And I'll tell you why. The FDA is very clear in what they said. Number one, human cell tissue products that are approved for use in joints have to have 4 criteria. The first 2 are the most important. Number one, it says that the cells have to be homologous in use. Number one, what does that mean? They have to be used for a similar purpose. So if you're going to take cells from body fat and put them into your knee joint, there's no fat inside a joint. It's not homologous in use. But more importantly, the second thing that the FDA says is the cells cannot be manipulated more than minimally. And when you take stem cells from body fat using liposuction, and you have to extract stem cells from the body fat, you have to use an enzyme called collagenase. And when you use that enzyme to extract this fraction of cells from body fat, you're manipulating the cells in a way that the FDA says is more than minimally. So it makes it non-compliant. So you just can't use it. And that's why we're not going to discuss it more than that. So what can you use? You can use bone marrow concentrate. Let's talk some numbers. Bone marrow concentrate means that someone is going to drill into the back of your hip while you're awake, because you could numb tissue, but you can't numb bone. They're going to drill into the back of your hip and they're going to start to extract bone marrow up to 10 mLs. And what we're going to find is that out of the cells that we pull from bone marrow, you're going to get between 100 to 300 million live cells. Now that sounds like a lot of cells. The more cells, the better. But the great majority of those cells are called hematopoietic stem cells, meaning they're blood type stem cells. In fact, those are the cells that the FDA approves to be used for bone marrow transplants for patients that have had blood type cancers. So leukemia, lymphoma, those cells are very, very useful to help someone rebuild their immune system when they've been so weakened by chemotherapy. But those cells in orthopedics that are approved for use, if you got 100 to 300 million live cells, those are a percentage of cells that are useful in the joint. So what do I mean? As a newborn, 1 in every 10,000 bone marrow cells is a mesenchymal cell, or a tissue stem cell that's useful for regeneration. The average 50-year-old, 1 in 400,000 of those cells is a mesenchymal cell, useful in orthopedics to stimulate the body to work properly. So the average 50-year-old that's having back pain, that's having neck pain, that's having shoulder pain and knee pain, let's just say you had an excellent bone marrow draw. You pulled out 300 million live cells. The average 50-year-old, 1 in every 400,000 of your bone marrow cells is a mesenchymal stem cells. So when you do the math, dividing 300 million by 400,000, you're lucky to get 750 cells that are going to work inside your knee. It's not enough. It's not appropriate to take bone marrow stem cells and put them into your knee the same way that it's not appropriate to treat cancer with stem cells that come from umbilical cord tissue. It's apples and oranges. So let's talk about what is appropriate and what is compliant. The Wharton's jelly, or the allografts that contain stem cells that come from umbilical cord tissue, have the highest concentration of useful tissue cells of any human body part. What we use here in the office contains 1.3 to 1.6 million live cells. 25 to 35% of those cells are the mesenchymal tissue cells that your body utilizes to repair and regrow tissue. So you're talking about 400 to 600,000 cells coming from umbilical cord tissue versus 750 that comes from the highest quality bone marrow draw that you can get. 400,000 compared to 750. Which one would you rather use? And the fact is that these stem cells, keep in mind, they release growth factors. Growth factors are what your body uses to regrow and repair tissue. The younger you are, the stronger the growth factor. The older you are, the weaker the growth factor. So when we get in a little bit deeper into this, each cell within a tissue stem cell every cell has chromosomes in it. And every chromosome has something on it called a telomere. And as we age, the telomeres get shorter and shorter and shorter and shorter until they completely disappear and the cell dies. An aging cell has a very, very, very short telomere, meaning the cell is weak. A tissue graft that contains stem cells from umbilical cord tissue has very, very, very long telomeres, meaning the cell is exceptionally and extremely strong. When you combine those cells with the cells already in your body and combine them with oxygen therapy, you create the optimal environment for your body to heal by itself, without drugs and without surgery. And that's what we utilize here at Advanced Physical Medicine and Rehab of Miami. Remember, apmrmiami.com is how you could find us on our website and on Instagram at apmrmiami. So now that we've spoken about getting these healthy cells into the joint, exposing these cells to oxygen so they can grow completely until your body is fully healed, meaning you're moving from a painful condition to more mobility and less pain, the third secret to keeping the joint healthy is to control your body weight. And this is so important that I've saved it to last to discuss it. And when we're talking about joint health, every pound of body weight that you gain that is over and above your optimal is equivalent to 4 pounds of pressure crushing your back, crushing your knees, and crushing your hips. So for someone who says, I'm just 10 pounds or 20 pounds overweight, your body, your joint thinks that you're 80 pounds overweight. So losing weight and keeping it off is extremely important to maintaining the longevity of your own joints and even the joints that you've repaired using regenerative medicine. So if you're out there sitting in your car, 305-598-8788 is the number to find out how we can help you repair these joints, get the body to heal itself. And if you're having trouble losing weight, the reason you're having trouble is because you haven't found the weight loss program that works right for you. In our office, since we're a physical medicine office, we do blood work on every single patient. The blood work, which tests hormone levels, vitamin levels, cholesterol levels, sugar levels, tell us the exact diet that's going to work for you to help take off massive amounts of weight in a short period of time, safely and effectively. So let's recap. If you want healthier knees, if you want healthier lower backs, healthier shoulders, and healthier hips, number one, you have to get the correct diagnosis. If the condition is degenerative, there's only 3 ways that you're wanting to treat this. Number one, get oxygen into those tissues as quickly as possible. Number 2, add more cells when appropriate, and the cells that you add have to be younger and stronger. Those are the cells that come from the allografts that contain stem cells from umbilical cord tissue. And number 3 is lose weight and keep the weight off. So that's the solution. The next thing is, what are you going to do? Are you going to sit out there and wait for it to get worse, or are you going to actually do something and change the quality of your life? All of these things that I talked about today are amazing procedures. They're cutting edge technology, but they only work when you make a call. They only work when you make the decision to change your life. We can't do it for you, but I can promise you this: inactivity is activity. And inactivity, what I mean by that is inactivity means that the activity of degeneration is going to continue to get worse really, really, really quickly. Do something, change your life, get the things back that you love to do, and stop thinking about the knee, the shoulder, or the back, keeping you from the things that you love to do. The best part about this is the procedure is quick, it's easy, it's simple, it's non-surgical, it's done here in our office, and you keep doing the things that you like to do. If you work, you can still work. If you work out, you have to cut it back, but you could still work out and exercise. It doesn't involve taking off any time from work or doing the things that you love to do. That's what the best part about this is. And the third thing is, it's painless. It's painless. It's done here in the office. It doesn't involve anesthesia. It's a quick injection, some laser therapy, and you're out doing the things that you want to do instead of being stuck in a physical therapist's office or stuck getting your knee joint replaced and not getting the results that you want. So how do you get these things treated? Number one, you got to call the office. You got to come see us. But number 2 is, how do you pay for it? Because every single thing that I told you about today is absolutely necessary if you want to recover, but they're not covered by insurance. And what that means is it's a big responsibility that's put on us as the providers to make it affordable to you, and we do that. There are lots of options that we have available to make these treatments not only affordable, but flexible. So people can get into these treatments no matter how advanced, no matter how many body parts that you need treated, by fitting it into your budget comfortably. Our office manager, Robert, is always here every day that we're open to make these plans available. Remember, if we give you the information and it makes sense to you, both in terms of the treatment and the financials, you're going to do it and you're going to have great results. And if it doesn't, then you've taken the information and you've made a decision on how you want to live the rest of your life. But feel good about what you do. As long as we give you the information and educate you about the condition and that there are treatment options available, the final decision always rests with you on how you want to live the rest of your life. For me, I'm almost 50. I want to be 100, and I want all of my listeners and patients to be 100, and I want them to be 100 with healthy function and with little to no pain. Remember, if your condition is degenerative, it is getting worse with time. It will not stop unless you do something about it. Number two, doing the same things over and over and over again and expecting a different result is the definition of insanity. You've heard it before. You've heard it from me. You've heard it from Albert Einstein, who's the one who came up with that quote. Do something different. You owe it to yourself. You owe it to the people around you to not be a burden to them. Take the stress off of your life. Take the stress off of their lives and get your body healthy again. Remember, the right doctors, the right treatments, the right results. That's Advanced Physical Medicine and Rehab in Miami. The next podcast, we're going to talk about ways to keep the body healthy once you've done regenerative medicine, once you've done stem cell therapy. We're going to talk about how to balance hormones in a safe and effective way, how to really increase your testosterone levels to keep your muscle mass high and to keep your fat low. The key things to remember, you want to repair the structure, you want to replace what your body cannot make enough of anymore, and you want to regenerate and let your body heal itself. I'm Dr. Joe Gambardella of Advanced Physical Medicine and Rehab of Miami. You can find us at apmrmiami.com. Definitely follow us on Instagram at apmrmiami. Call the office at 305-598-8788. Every patient that calls us is going to sit down with me and one of my colleagues to discuss the case in its entirety. And if you're a great candidate, we're going to let you know. And if you're not, we're going to let you know that too. Until then, stay well, be strong, and we'll see you next time.